Now coming to mechanism of labor. Let me first show you all the PPT so that things are more clear that way. So this is your diagnosis. First thing, how you will diagnose on a per abdomen examination. Next, on a per vaginal examination. These are the corresponding per abdominal and vaginal views. For all of you, see here, you can clearly make out, the anterior fontanelle and the posterior fontanelles are almost lying at the similar levels. The bregma lies to the left of the symphysis pubis. This is our right, this is left, and the bregma is lying to the left of pubic symphysis, whereas the posterior fontanelle is lying in the posterior segment and to the right posterior segment of the pelvis. I hope things are making more clear, more sense now. So in ROP, when occipito-posterior, when you read about the mechanism of labor, there can be two pathways. One is a favorable pathway which can result in vaginal delivery. So the answer to your question which was asked at the beginning was, not all occipito-posterior positions need to undergo cesarean sections. They can undergo vaginal delivery. Sometimes the progress of the labor might be delayed and you might need to intervene. Okay, but vaginal delivery can be allowed. So the mechanism of labor are three. And the outcomes are two, either a favorable outcome or a not favorable outcome. Let me come to this first. Okay. Favorable outcome is seen in as high as 90% of the patients. What happens is, I hope you all remember the steps of mechanism of labor, the cardinal movements. Should I go back and revise with those? It is ED figure, that is engagement, flexion, descent. Again, flexion goes on happening. Then there is internal rotation, restitution, delivery, external rotation, and then relaxation, like extension of the head that happens. So the favorable outcome that happens in 90% of the patient, there is increased flexion with engagement. There is a long internal rotation. How much is the normal internal rotation? Can anybody tell? In a normal LOA or ROA, how much is the internal rotation that normally happens in labor? It happens to the tune of 1/8 of a circle. If the engagement happens in posterior positions, the rotation has to be longer, which is 3/8 of a circle or 135 degree. Here it is 1/8 or 45 degree internal rotation. Sometimes the outcome may be unfavorable. There is delayed engagement, deflection persists, and patient might land up into arrest or cesareans. Most of the cases, that is 90%, spontaneous vaginal delivery by normal labor can happen. I'll explain you one by one, coming to all of that. Descent up to pelvic floor. Suppose descent has happened till the pelvic floor in unfavorable. There are again three outcomes. If it is an android pelvis, that is, the pelvis is not, the outlet is contracted, the anterior rotation of occiput happens by only 1/8 and there is deep transverse arrest. Just read this flowchart and I will discuss each one of them in detail. Second is, it is a contracted pelvis where moderate deflection persists and there is non-rotation of occiput. So that is like called as oblique posterior arrest. And then there is a third possibility where there is an anthropoid pelvis. So anthropoid favors posterior. Severe deflection persists and posterior rotation of the occiput occur. So either the delivery will happen through occipito-sacral position, which is called as face to pubis delivery, or it can also undergo arrest, which is called as occipito-sacral arrest, and it is not favorable.